Hi, my name is Dr. Jeff Harris. I am a psychologist in New Mexico in the southwestern part of the United States. This is lesson 2 in key strategies training, and today we're going to be focusing on exploring thoughts using cognitive strategies. And this presentation was developed with my colleague Erin Hammond when we were both working at Texas Women's University about 10 years ago in 2011. So this is lesson 2. In lesson 1, we talked about how thoughts, feelings, and actions interact, and talked about the importance of being able to address the importance of counselors and psychotherapists being able to address thoughts, feelings, or actions using cognitive strategies, emotion-focused strategies, and behavioral strategies. And today we're going to be focusing on cognitive strategies. And then so today we're going to be exploring thoughts, and in lesson 3 we're going to be changing thoughts. So the strategies that we're going to be talking about today are drawn from cognitive therapy. Cognitive therapy was originally developed by Dr. Aaron Beck in the 60s and 70s. He wrote about a book about depression in the 60s, and then wrote the first book about cognitive therapy in the 70s, and then has applied cognitive therapy to depression and anxiety and substance abuse and many, many different disorders over the decades. So Aaron Beck was a psychiatrist. His daughter, Judith Beck, is a psychologist and has continued his work. And the best current overall book about cognitive therapy is called Cognitive Therapy, Cognitive Behavior Therapy, Basics and Beyond. It's in the 3rd edition in 2020. So here's a copy of the 3rd edition. So if you want a good overview of cognitive therapy that goes into more depth than we can go into here in Key Strategies Training, I recommend you check out this book, Cognitive Behavior Therapy, Basics and Beyond by Judith Beck. So cognitive therapy is based on a cognitive model, and one of the key ideas is that thoughts influence both emotions and behaviors. Distorted thinking leads to dysfunctional emotional and behavioral responses. And because of that, targeting dysfunctional thinking produces emotional and behavioral change. So cognitive therapy really focuses on cognition, thoughts, beliefs, perceptions as a primary source of distress and psychological problems. And so they look at those thoughts really carefully, and then to try to change those thoughts as a way to decrease symptoms and to increase functioning. For the most part, cognitive therapy is time limited. Often, many of the clinical trials have been about 12 sessions or 18 sessions. It's present focused. So unlike psychoanalysis, which went into a lot of depth about the origin of problems, cognitive therapy focuses a little bit more on the present, although they acknowledge that present patterns of thinking are learned from the past. It's symptom focused. Cognitive therapy often uses symptom checklists like the Beck Depression Inventory and the Beck Anxiety Inventory to look at specific symptoms and to make sure that treatment is working by watching symptoms decrease. It's goal driven, and it's collaborative and active. And so collaborative empiricism is a really important idea in cognitive therapy. And collaborative empiricism means that you and the psychologist or counselor, the psychotherapist or counselor, and the client work together to test their thoughts and beliefs to see if they're accurate and functional. So that's the idea of collaborative empiricism. So cognitive therapy, starting in the 70s, has been very well researched, and so there's a strong base of empirical support. Cognitive therapy has been applied to a variety of DSM diagnoses, starting with depression and then anxiety and then many other disorders. it's been applied in different modalities and across many different populations. So it has been the most well-researched treatment. And so that's one of the reasons it's so popular, is that they, from the get-go, cognitive therapists made sure that they were testing their work to see if it was effective. So the exploring thought, our theme today is going to be exploring thoughts. In lesson 3, we're going to be talking about changing thoughts, but today we're going to be exploring thoughts. So here's a quote from Judith Beck's book. The usual course of treatment in cognitive therapy involves an initial emphasis on automatic thoughts, those cognitions closest to conscious awareness. The therapist teaches the patient to identify, evaluate, and modify her thoughts in order to produce symptom relief. Then the beliefs that underlie the dysfunctional thoughts and cut across many situations become the focus of treatment. So you can see here they're describing two different thoughts. Automatic thoughts, which are the ones that come through day to day. So if I have a stressful event, I might say, I'm going to mess up. And then that may be my automatic thoughts. At a deeper level, the underlying beliefs, the core beliefs, the schemas may be, I'm incapable or I'm incompetent. And so it's important to think about both the automatic thoughts at the surface level and then the core beliefs at the deeper level. So we're going to be describing four key strategies for exploring thoughts today. In lesson 3, we'll be describing 4 more strategies for changing thoughts. But for each of the strategies, whether they're cognitive, emotion focused, or behavioral, we're going to be describing them using a parallel structure. So we're going to start with the theoretical context. So usually this is a quote from a primary source, in this case, mostly from Judith Beck's book. We're going to be describing a strategy marker, which answers the question, when is this intervention most useful? We're going to be providing some suggestions for use that answer the question, how can this strategy be implemented with clients? We're going to be describing an expected consequence. What is the predicted outcome of using this strategy? And then we're going to give you a short example, the sample dialogue between counselor and client. And it's important to remember that the sample dialogue is something that Aaron and I wrote as a short example, and how you implement this strategy is going to look different. So we want you to learn these strategies because research has supported that they're effective, but we also want to encourage you to find your own way, and that's some creativity within the model or some flexibility within Fidelity. So we're going to be talking about 4 cognitive strategies for exploration. Focusing on thoughts, understanding the impact of thoughts, analyzing thoughts, and discovering core beliefs. So here's the first cognitive strategy in lesson 1, focusing on thoughts related to clients presenting concerns. And this really moves from a general discussion to a more focused discussion. So the context here is the usual course of treatment involves an initial emphasis on identifying and modifying automatic thoughts. So we're starting with those surface level thoughts. What were you thinking at the time? In strategy 4, we'll be talking about core beliefs. So the strategy marker is that when dysfunctional thoughts seem to play a key role in promoting and maintaining emotional distress, it may be helpful for counselors to focus clients' attention on their conscious thoughts. So when you think there's something going on that may be impacting their functioning, and there's always a cognitive component, then it's helpful to slow down and focus in on thoughts, move from kind of that casual description to a more focused discussion. One suggestion for using this is that in order to facilitate a cognitive focus, counselors may listen to a client's description of specific events and ask, what were you thinking in that situation? What was going through your mind then? So if I'm, talking to someone who had a fight with their boss, I might say to say, okay, I'm understanding how stressful this situation with your boss was. When your boss was criticizing you, what were you thinking in that situation? What was going through your mind? The expected consequences is that we predict that a focus on thoughts will lead to overall increased awareness of cognition, which is necessary for clients to do more in-depth cognitive work, such as evaluating automatic thoughts and observing the effects on emotions and action. So here's an example. A client might say, I get so nervous being around groups of people that most of the time I just avoid any kind of social situation. I feel like I'm missing out on so much, but I just don't know how to deal with my nerves. The counselor might respond by saying, it sounds like your anxiety really gets in the way of being able to interact with people, especially socially. What goes through your mind when you think about being around a group of people? So there's that question, focusing on thoughts. What's goes through your mind? What are you thinking? What are the words that you're saying to yourself? So that's the first strategy, focusing on thoughts. The second cognitive strategy is understanding how thoughts mediate experience and impact mood. So here's the theoretical context. The cognitive model states that the interpretation of a situation, rather than the situation itself, often expressed in automatic thoughts, influences one's subsequent emotion, behavior, and physiological response. So the example I give is that if you're fired from a job, it seems in day-to-day life, it seems like the activating event, like getting fired from a job, directly impacts your emotional response, like feeling discouraged and ashamed. But the cognitive model, and this is one that both Aaron Beck and Albert Ellis agree on, is that the beliefs or thoughts mediate that. So if I'm fired from a job, if my thought is I really messed up, I'm incompetent, then I might feel discouraged and ashamed. However, there's another way that I might respond if I have a different set of beliefs. So if I'm fired from a job, but my belief is that job was not a good fit, I really need to find something that better matches my skills, then I might not feel discouraged and ashamed. I might feel relieved and motivated to move forward. So we want to understand how thoughts mediate experience and impact mood. The marker for this strategy is that once clients are able to more intently focus on conscious thoughts, the next step is to assist them in observing how their perceptions and interpretations of situations may negatively impact their mood and behavior. When you were thinking this way, did it increase your mood? Did it make you anxious? Did it make you depressed? Did it make you worried? And then how did that impact your subsequent behavior? So one suggestion is that counselors can help clients to see links between thoughts, feelings, and actions by listing specific emotions and behaviors that flow from the identified problematic thoughts. When you thought such and such, how did you feel? How did you act? So the consequence of helping clients understand their thoughts is that the ultimate goal of this strategy is to increase clients' awareness of how thoughts contribute to affective distress and ineffective behaviors. Recognizing these links is necessary before strategies aimed at changing dysfunctional thoughts can be used effectively. So here's another brief example. The client says, I guess I start to worry that people won't like me and they'll make fun of me. And so there, I highlighted in red kind of the thought, people won't like me. So the counselor says, when you think about this, when you think that people don't like you, how do you feel and what do you do? So the client says, I feel nervous and I want to avoid the whole situation. So usually I just stay home and I don't have to deal with it. So in this case, the thought, people won't like me there in the first line, the impact on emotions is that it elicits anxiety, and then the behavioral impact is avoidance and just staying home to deal with social situations. So here's an example of social anxiety where the thought, people won't like me, it elicits fear and anxiety as well as avoidance as a coping strategy. So that's the second strategy, understanding thoughts. Let's move on to the next one. So the third cognitive strategy we're describing here in Key Strategies Training is analyzing thoughts to evaluate their functional value. So the context here is you are concerned with identifying those thoughts that are dysfunctional, that is, those that distort reality, are emotionally distressing, or interfere with patients' ability to reach their goals. So the cognitive therapy, particularly Aaron and Judith Beck, talk a lot about dysfunctional thoughts. Albert Ellis talked more about irrational thoughts. And there is sometimes dysfunctional thoughts are inaccurate, like nobody likes me. But other times that they're dysfunctional because they lead to emotional distress. So the strategy marker is that once the impact of thoughts on feelings and actions has been clarified, the next step is to evaluate which thoughts are inaccurate or distorted and in need of modification. So some thoughts may be accurate and may not be leading to distress, like not everyone likes me is an accurate thought, but no one likes me is an inaccurate thought. So here's a suggestion for putting this one into practice. When faced with numerous dysfunctional thoughts, counselors can assess the frequency and intensity of distress caused by each identified thought in order to decide where to focus initially. It also may be helpful to consider which thoughts occur in distressing situations that clients are unable to resolve and how much they interfere with their ability to meet goals. So when you identify thoughts about a situation, there may be 3 or 4 distressing thoughts. And to analyze one, you're going to pick one which leads to a lot of distress. And often it's helpful to choose one where you can see the distortion and think that you'll be able to help the client see why a particular thought is dysfunctional. So the predicted consequence of analyzing thoughts is that as counselors and clients analyze thoughts, it is expected that they will gain increased awareness about how particular thoughts are impacting the client and where subsequent interventions should be focused in order to maximize therapeutic efficiency and effectiveness. So here's another example. The counselor says, so it seems that when you think about people not liking you, you then worry they'll make fun of you. This makes you feel anxious and leads you to avoid this whole situation. And then the client says, exactly. I just get so afraid that people will be mean to me that it paralyzes me. I can't go out with my friends no matter how much I want to, and I'm getting really isolated. So we've identified that thought about people not liking the client. That is a dysfunctional thought that creates fear and anxiety and results in paralysis and avoidance. So that's the analysis there. That it's this thought, people won't like me, is dysfunctional because it creates disproportional fear and results in paralysis and avoidance. So let's move on to the fourth strategy that we're going to be talking about, exploring thoughts. This one is discovering underlying core beliefs or schemas that influence conscious thought. Here's the theoretical context from Judith Beck. Look for central themes in the patient's automatic thoughts. Watch for core beliefs expressed as automatic thoughts, and directly elicit the core beliefs. So we talked about before that automatic thoughts are the ones on the surface that go through your mind throughout the day. And then core beliefs are the longer standing schemas or ways of thinking that often generate automatic thoughts. So the marker here is that as automatic thoughts are elicited using exploratory cognitive strategies, counselors can listen for themes that may represent underlying core beliefs. So here's a suggestion. Some helpful strategies for uncovering core beliefs include asking clients for the meaning of their automatic thoughts, eliciting rules and attitudes driving automatic thoughts, listening for ideas related to helplessness and unlovability, and observing noticeable negative shifts in affect in conjunction with a particular thought. So there's a lot in that suggestion. So let me highlight a couple of those. The looking for the meaning of automatic thoughts is a technique called the downward arrow technique, where automatic thoughts are on the surface and we're going to ask questions that lead us down to the core belief, which is at a deeper level. And so if someone says, people won't like me, you may look at that, what does that mean? And so the deeper asking, what does that mean about you if people won't like you? If that were true, what would that mean? That might lead down to the core belief. There's two words there, helplessness and unlovability. And Judith Beck talks about most core beliefs, many clients' core beliefs are related about being helpless. I can't change anything about my situation, or unlivability. People aren't going to be able to accept me for who I am. So the consequence of discovering core beliefs is that when a counselor helps uncover core beliefs, this will assist clients in gaining increased awareness of long-term maladaptive thought patterns that serve as a cognitive filter and influence interpretation of events in the environment. So again, let me highlight a couple words in there. Cognitive filter means that we filter our experience based on our core beliefs. Our core beliefs shape the way we interpret our experiences, and we are more likely to notice evidence that confirms our beliefs than evidence that disconfirms them. So that's what I mean by a cognitive filter that influences interpretation. So here's an example of discovering core beliefs. It sounds like this debilitating anxiety is linked to worry that people won't like you, the automatic thought, which will lead them to bully or ridicule you. I wonder what leads you to worry that people won't like you and will try to embarrass you. And so the client says, I think about how in high school kids would always make fun of me and it was so embarrassing. They would say mean things about me being gay. I started thinking that there's something wrong with me and that I'm unlovable. So the core belief here is we've got a couple things. One is that the client has identified specific beliefs that are at that deeper level. There's something wrong with me and I'm unlovable. And it might be helpful to understand, to identify with the client, which of these is the core belief that we want to work on. There's something wrong with me or I'm unlovable. Those are obviously related, but which of those is more powerful may be something that you can clarify with the client. We also get here a little bit of the developmental context of where these core beliefs come from. So this client is talking about being gay and being made fun of in high school and having mean things to say about them. So being a gay teenager in a high school and being and receiving discriminatory comments, that's the developmental context of how this core belief developed, that there's something wrong with me and that I'm unlovable. So these are the 4 strategies that we're suggesting you learn and practice to explore thoughts. And so the next part in the key strategies training is to practice these skills in role play. So hopefully if you're learning this in the context of a class or with an instructor or teacher, that will be the teacher's role to help you set up a role play. If you're just watching these videos on your own, you may want to reach out to another student or another counselor or psychotherapist who's learning these. So in a role play situation, one trainee will play the role of a client and another student will practice exploring the thoughts that underlie their distress. If you've got 3 people in a group, if they're the third trainee in your group, the third person can observe and provide feedback. So once you've learned and read about these strategies, it's real important to practice. So that's the next step. And once you have practiced these 4 cognitive skills for exploring thoughts, the next step will be to learn about how to help clients change thoughts. And that's going to be lesson 3 in key strategies training, changing thoughts. So during the next lesson, we'll learn about experimenting with thoughts to evaluate their accuracy and test alternatives. We're going to talk about modifying beliefs and identifying more functional thoughts. We're going to talk about reinforcing functional thoughts and putting these beliefs into practice. Then we're also going to be talking about assessing cognitive change, looking at the multidimensional impact, and considering a shift in focus. So that's lesson 3. So I hope you come back and watch the next video about changing thoughts. Thanks a lot for your time and attention, and I hope this has been a helpful video in helping you think about how to explore your client's thoughts as a counselor or psychotherapist.